Hi, my name is Rachel Myers, and in honor of World AIDS Day, I'm going to be talking about HIV in the country of Malawi. The World AIDS Day project, its purpose is to support World AIDS Day and to raise awareness of HIV globally, and we celebrate World AIDS Day on December 1st. General information. The country of Malawi is located in southern Africa, east of Zambia, west and north of Mozambique. And in the map, it gives you a visual idea of where it is. The population is 19,196,246, and the unemployment rate is 20.4, which is relatively high. But that is expected in an area of poverty and all that. So as far as education goes, 62.1% of the population is literate, meaning 62.1% of residents age 15 and above can read and write, which that is pretty low too, but also, again, understandable because of poverty and less people enrolled in school and all that. The median age for residents in Malawi is 16.5 years. That is a pretty low median age, but that is due to a larger young population and a lower life expectancy, which is 61.7 years in Malawi. Okay, so epidemiology in Malawi. In 2017, there were 39,000 newly infected, and out of 19,196,246 people in Malawi, 1 million of them were living with HIV in 2017. Also in 2017, there were 17,000 AIDS-related deaths total. And the modes of transmission in Malawi, the main ones are heterosexual sexual transmission, and 67% of that is between married or cohabiting partners, and 12% of that is from casual sex. Another major mode is male-to-male sexual transmission. And the groups that are most affected with HIV are sex workers and men who have sex with men. And sex workers, 24.9% of them have HIV. That's nearly a quarter of sex workers that have HIV. And to make money, they obviously are having sex, and a lot of them don't use proper protection, or a lot of them don't even know they have HIV and are just transmitting that to more and more people. So it is very important for them to get tested and to be aware of all the risks and everything that come with it. And then also men who have sex with men, 17.3% of them have HIV. So it is important for these subgroups to use protection when necessary, or use protection at all times, and just get tested. If they are positive, get therapy, get help. There's a lot out there for them. Healthcare response. Antiretroviral therapy in Malawi, the rates are pretty good considering the conditions there. 68% of adults with HIV are on antiretroviral therapy, and 49% of children with HIV are antiretroviral therapy. They aim to get all those numbers up to 90%. And the cost of antiretroviral therapy is $136 per patient per year, which is really high considering there are 1 million people living with HIV in Malawi. Currently, 170,000 people need antiretroviral therapy, and there are 716 ART clinics and that was in December 2015, so I'm sure there are a lot more now. What is being done to prevent the spread of HIV? Currently, there are a bunch of organizations and groups out there working to raise money and raise awareness for HIV and promote healthy behaviors and all that. The Joint Church response to AIDS, they have donated $1,514,961 to Malawi, and the Joint Church response to AIDS, that's basically a couple churches partnered together to raise money and one big lump sum for Malawi AIDS and HIV research and therapy and everything needed. Another big one is the prevention of mother-to-child transmission services, and that is where all pregnant women living with HIV are offered antiretroviral therapy for life. That's a great one because it targets the younger population and the prevention of transmission to them, so they can grow up and without HIV, and in turn their kids can grow up without HIV, and so on and so forth. It's basically targeting the younger population because the older population they already are moving on, and they just want to target the younger ones for those reasons. Malawi's National HIV and AIDS Strategic Plan 2015 to 2020, they are basically researching and sitting back and looking at the risks and the most prevalent risks in Malawi, and they are, by 2020 they hope to have many more programs for those with HIV and programs geared towards the prevention of HIV. And there are life skills education courses that are offered also in the academic settings in Malawi. Not everybody goes to school, but those who do go to school, they are being educated on HIV and AIDS through these courses. And the life skills education courses, they focus on mutual faithfulness. So having one sexual partner when you're in a serious relationship. And they also focus on condom use, and they teach how to use female condoms and male condoms. Radio shows, they have lots of radio shows in Malawi. That's one major way to get the message across. They have many jingles and advertisements on the radio, just reminding people to get tested, reminding people of the risks and the prevalence of HIV in the area. And I think by having those little constant reminders throughout the day, like, it just puts a little bug in your ear. So I think that is very important. For those little things matter. The Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the President's Emergency Plan for AIDS Relief, that is where Malawi has gotten 74% of their funds for AIDS and HIV, which is huge. Without those associations, Malawi would be in a completely different state regarding HIV and AIDS, and unless money was coming from somewhere else. That's a big thing. PrEP is also, that's coming in the future. PrEP is basically is geared towards, for those in like a hospital setting, for if they're working with a HIV positive patient and they get pricked, or any risky situation happened like that, within 3 days of that risky situation, they take the PrEP and continue to take it for 4 weeks to ensure that their viral levels, and to basically prevent the HIV from reproducing in their blood. Also, HIV testing In 2017, during the first 3 months of 2017, there were 982,560 people who were tested, which is huge considering that in the past years, 1.8 million had been tested throughout the entire year. So throughout the first 3 months of 2017, they are testing the same amount of people that they had been testing throughout the entire year in 2016. So by the end of 2017, they quadrupled that number, for example. And in 2009, there were 984 testing sites. So it is right to assume that they have many more now, with all of the research and HIV and AIDS promotion and prevention and awareness and all that. In the future, UNAIDS, it's a goal for many countries as far as their HIV prevalency in the area, and it's called the 90-90-90. And so basically 90%, they have 3 separate goals that kind of go together. The first one is to have 90% of the population be aware of their HIV status, and then 90% of those with HIV, they want 90% of them to be currently in therapy, and then also they want 90% of those in the therapy to be virally suppressed. By making small goals like that, it's making the end goal a little bit easier to see. And also for testing, as far as testing goes, providers are initiating testing more frequently. So when people go in for a checkup, they they don't bug people about getting tested, but they kind of remind them the importance of it and just kind of offer it as one of the routine tests that, just like I don't know, like the STD testing, just testing that they think would be good considering your risks and your conditions. So they try to normalize it and make people not feel weird for getting HIV tested. And then I have on the next slide a PSA, public service announcement, targeting the Malawi population, specifically those that are at risk of HIV. So hopefully it puts a buzz in people's ears so we can start making a difference in Malawi. Out of 19,196,246 residents of Malawi, 1 million are infected with HIV. That is nearly 5.2% of the population. If you are at risk of HIV, we strongly encourage you to get tested. The major modes of transmission are male-to-male sexual transmission and heterosexual sexual transmission. So if you participate in these, or if you don't, we encourage you to get tested. Let's work together and break the social stigma of HIV and AIDS.